Do you ever wake up in the middle of the night with that familiar burning feeling creeping up your chest? Or maybe you sit up in bed a little short of breath, wondering why a full night's rest still leaves you stiff and uncomfortable. If either of those sounds familiar, stay with me for a few minutes, because what we're covering today might genuinely surprise you. To be clear right away, we're talking about the kind of ordinary, familiar heartburn that shows up after a heavy meal or a late dinner. Not sudden or unexplained chest pain, which is always something to take seriously and get checked by a doctor rather than something to try to sleep your way out of. With that said, here's something most people never stop to think about. The side you sleep on every night may be quietly influencing how your digestion works, how comfortable your breathing is, and even how your body feels when you wake up. It sounds almost too simple to matter, but for many adults over 60, it does. Maybe you've tried a few different things already, cutting back on coffee, propping up an extra pillow, going to bed earlier, and you're still waking up, feeling like the night didn't do its job. Sometimes the missing piece isn't something new to add. It's something you're already doing every single night, just done a little differently. Here on this channel, we look at the small, everyday habits that can affect how we feel as we age. Not the dramatic stuff, not the miracle cures, just the ordinary, overlooked details, like how you position your body for the 7 or 8 hours a night when nobody's watching. Today we're talking specifically about sleeping on your left side, what research suggests it may actually do inside your body, and just as importantly, what it does not do. By the end of this video, you'll understand why this simple position keeps coming up in conversations about digestion and comfortable aging, and how to try it without forcing anything that doesn't feel right. Before we go further, one thing needs to be said clearly. There is no single sleeping position that's universally correct for every body. Your body isn't identical to your neighbor's, and what works beautifully for one person may do nothing for another. What we're exploring is a pattern that shows up repeatedly when researchers look at posture, gravity, and how our organs are arranged. For some people, especially those dealing with nighttime reflux, the left side may offer a real, physiologically sensible advantage. For others, it may make little difference. The goal here isn't to hand you a rule. It's to hand you information so you can make a more informed choice for your own comfort. Let's start with the strongest part of this story. Acid reflux, because this is where the science is most consistent and most relevant to this age group. Reflux tends to become more common as we get older for a few reasons. The lower esophageal sphincter, the muscle that acts like a one-way valve between your esophagus and stomach, can lose some of its tone over time. Certain medications, changes in body composition, and the natural aging of connective tissue can all play a role. When you lie flat on your back, or on your right side, stomach contents have an easier path to move upward, especially if your stomach is fuller than usual. Here's the part many people with nighttime heartburn don't realize. The side you sleep on may influence what happens at that valve after you lie down. Your stomach sits slightly toward the left side of your body, and the gastroesophageal junction, where the esophagus meets the stomach, sits at something of an angle relative to it. When you lie on your left side, that angle and the pull of gravity tend to work together in a way that may make it less likely for stomach acid to move upward. Lie on your right side, and the geometry shifts, which some research links to a slightly higher chance of reflux for certain people. Think of it less like a light switch and more like a gentle tilt in your favor. Your body isn't suddenly sealed off from reflux just because you rolled onto your left side, and it isn't suddenly vulnerable just because you rolled onto your right. The junction between the esophagus and stomach still relies mainly on the strength of that valve itself, and body position is simply one factor working alongside it, not in place of it. This doesn't mean right side sleeping is dangerous. It doesn't mean left side sleeping eliminates the problem, either. It's simply one of the more consistently discussed findings in research on positional sleep, and it's a detail many gastroenterologists mention to patients dealing with nighttime heartburn. Position alone rarely resolves reflux completely. It usually works alongside other factors like meal timing, portion size, individual food triggers, and sometimes medication. Think of left side sleeping as a supportive habit, not a cure. If you deal with a sour taste at the back of your throat or burning after a late dinner, this is worth knowing. And if that reflux is frequent, severe, or getting worse over time, that's worth mentioning to your doctor rather than managing through sleep position alone. There's a second, related piece to the digestion story, gastric emptying, or how efficiently your stomach moves its contents into the small intestine. Some research suggests that lying on the left side may support somewhat smoother movement of stomach contents compared to lying flat on your back, though the effect is likely modest rather than dramatic. As we get older, digestion can naturally slow a little, and muscle tone throughout the digestive tract tends to decrease over time. A position that gently supports that process, even in a small way, can be a welcome ally rather than a major fix, and it's worth keeping that expectation realistic. This isn't a position that will meaningfully improve nutrient absorption or transform your metabolism. The honest research points to something more modest and more believable. Picture two people who both had a slightly heavier dinner than they planned. One settles onto their back to relax before bed. The other lies down on their left side. Neither one has done anything wrong, and neither is guaranteed a particular outcome that night. But the person on their left side has, in theory, given gravity a small assist in keeping stomach contents where they belong. It's a modest difference, not a dramatic one, but modest, sustainable differences are often exactly what matter most at this stage of life, more than any single big intervention. Now let's talk about the heart, because a lot of oversimplified claims circulate online, and I want to be careful here. There is no universal rule that sleeping on the left side is better for heart health, and this video is not claiming that it prevents heart attacks or lowers cardiovascular risk. It doesn't. And any source telling you otherwise is oversimplifying real physiology. What the research actually shows is more individual. How a sleeping position feels can depend heavily on a person's own cardiovascular history. Some people with certain heart conditions report feeling more comfortable on their right side. Others notice no meaningful difference between sides at all. If you have a diagnosed heart condition, your ideal sleep position is a conversation worth having with your cardiologist, because it may genuinely differ from someone else's. For most healthy older adults without significant cardiac issues, comfort, not risk, is the deciding factor. Some people simply feel their heartbeat more when lying on their left side, which can feel unsettling even though it isn't harmful. That awareness alone leads plenty of people to naturally prefer their right side, and that's a perfectly reasonable choice. When it comes to the heart, comfort and your own medical history matter far more than any universal sleeping position rule. Breathing comfort is another piece of this puzzle, and it's worth separating two ideas here. Side sleeping in general, not the left side specifically, tends to help keep the airway a bit more open than sleeping flat on the back, where the tongue and soft tissue can shift backward and partially block airflow. That's part of why snoring often gets worse when someone rolls onto their back. But that's a general side sleeping effect, not something unique to the left side. And if you or someone close to you suspects sleep apnea, repeated pauses in breathing during the night, loud gasping, or excessive daytime fatigue, that's not something to manage through sleep position. It calls for a proper medical evaluation, possibly a sleep study. Left side sleeping may support easier breathing for some people, but it is not a treatment for sleep apnea, and it shouldn't be treated as one. If you already know you snore heavily, or a partner has mentioned that your breathing sounds irregular at night, that's worth raising with your doctor on its own, separate from anything about sleep position. Let's talk about your spine, hips, and overall alignment, because position is only half the story. Support is the other half. If certain nights leave your neck sore or your lower back stiff, that's often less about which side you're on and more about pillow height and spinal alignment. When your head, neck, and spine aren't roughly in a straight line, your muscles work overtime holding that position steady, and the tension carries into your morning. Many people over 60 find real relief simply by adjusting pillow height so the neck stays level with the spine rather than tilting up or drooping down. A soft pillow between slightly bent knees is another small adjustment that takes pressure off the lower back and hips, since it keeps your hips from rotating and stacking on top of each other in a way that twists the lower spine overnight. It sounds almost too simple to matter, but plenty of people find it makes side sleeping noticeably more comfortable than they expected. Shoulder and hip pressure also becomes more noticeable with age. Side sleeping concentrates more of your body weight onto a smaller surface area, your shoulder and your hip specifically. If you've woken up with a dull ache in one shoulder or a tingling or numb arm, that pressure point is very likely the reason, and as joints and cartilage change with age, some people become more sensitive to it than they were decades earlier. A supportive mattress that cushions those pressure points without letting your spine sink out of alignment can help, and so can shifting positions slightly through the night rather than staying rigidly locked in one spot. Left side sleeping isn't automatically superior here. If your left shoulder or hip is the one giving you trouble, favoring your right side, or alternating between the two makes complete sense. Comfort and proper alignment should always take priority over rigidly following a rule you heard in a video. So why does any of this become more relevant later in life? As we age, several small systems shift together. Joint comfort can change. Muscle mass and flexibility naturally decline unless we actively work to maintain them. Digestion often slows a little. And sleep itself tends to become lighter and easier to disturb than it was years ago. That's a normal, well-documented part of aging, not a sign that something is wrong. Because sleep is lighter, small sources of discomfort that once went unnoticed, a pinched shoulder, mild reflux, an awkward neck angle, are now far more likely to actually wake you or interrupt your rest. That's really why a detail as small as sleeping position deserves its own conversation at this stage of life. In your 60s and beyond, a position that barely registered as a factor decades ago can be the difference between waking up rested and waking up sore. None of this means something is going wrong with your body. It simply means your body is asking for a bit more attention to the details that used to take care of themselves. So let's get practical. If you'd like to try sleeping on your left side more consistently, here's how to approach it without forcing anything uncomfortable. Start gradually rather than trying to hold one position for 8 straight hours on night 1. Many people find it easier to simply begin the night on their left side and let themselves shift naturally if they wake up somewhere else. That's completely normal and nothing to worry about. Choose a pillow that keeps your neck reasonably level with your spine, not tilted sharply in either direction. If you have lower back sensitivity, try placing a soft pillow between your knees. Some people also find that hugging a slightly firmer pillow against the chest adds a sense of stability while they get used to a new position, and a pillow behind your back can help keep you from rolling fully onto your back during the night if that's a habit you're trying to shift away from. Give your body time to adjust over several nights rather than expecting it to feel natural right away. And above all, if a position causes pain rather than simple unfamiliarity, don't force it. Discomfort that fades after a few nights of adjustment is one thing. Discomfort that lingers or worsens is your body telling you something important, and it deserves attention rather than persistence. That leads to an important safety point. If you experience significant or unexplained chest pain, sudden or severe shortness of breath, reflux that is frequent, severe, or getting worse despite typical adjustments, or any new symptom you can't explain, please don't try to manage that through sleep position. Those are signs worth bringing to your doctor directly. Sleeping position can be a helpful, supportive habit, but it's never a substitute for medical evaluation, and nothing here should be treated as personal medical advice. Your own situation deserves a conversation with a healthcare provider who actually knows your history. It's worth addressing a few myths directly, too, because they circulate constantly. You may have seen claims online that left side sleeping detoxes your body, dramatically boosts circulation, or flushes out your lymphatic system overnight. There's no solid evidence behind those claims. Your kidneys and liver do the vast majority of your body's detoxification work, regardless of which way you're facing in bed. And for most healthy adults, there's no strong evidence that sleep position meaningfully improves kidney function either. People with a specific diagnosed kidney condition should simply follow whatever guidance their own doctor has already given them. You may also see claims that left side sleeping prevents heart attacks or cures sleep apnea. Neither is accurate, and anyone telling you otherwise is turning complex physiology into a catchy headline. You might also come across claims that sleeping on your left side guarantees better oxygen levels overnight or dramatically speeds up your metabolism while you rest. There's no solid evidence for either of those either. They're the kind of claim that sounds appealing in a video title but doesn't hold up when you look at the actual research. What the actual research supports is more modest and frankly more believable. For some people, left side sleeping may ease nighttime reflux, may support somewhat smoother digestion, and may contribute to more comfortable breathing. That's a realistic benefit. It just isn't a miracle, and the honest version is worth more than the exaggerated one. So here's what's worth taking away today. The side you sleep on isn't a switch that transforms your health overnight, but it's one small, low-cost, easily adjustable habit that may genuinely support digestion, ease reflux, and improve overall comfort for many people over 60. There's no single sleeping position that's perfect for everyone watching this, but left side sleeping may offer real advantages for digestion, reflux, and breathing comfort for a meaningful number of people, particularly later in life, while comfort and proper alignment matter just as much as which side you favor. If something causes ongoing pain, that's your body asking for attention, not something to push through. And if you're dealing with persistent chest discomfort, severe reflux, or breathing difficulty, bring that to your doctor rather than trying to solve it through sleep position alone. I'd love to know. Which side do you usually find yourself sleeping on, and have you noticed it affecting how you feel in the morning? Drop a comment and let me know. If this gave you something useful to think about tonight, consider sharing it with a friend or family member who might benefit, and subscribe if you'd like more of these everyday, practical topics for adults navigating this stage of life. Take care of yourself, and I'll see you in the next video.